In late 2019, the Chinese city of Wuhan was struck by a highly infectious flu-like virus, what we now know as COVID-19. 2 months later, the World Health Organization declared a global emergency.
I'm declaring a public health emergency of international concern.
Now, more than a year later, an international report has found that earlier intervention may have prevented the global pandemic. The report found countries around the world were unprepared for the virus and slow to respond. It also criticised the WHO's response as being limited. As the pandemic rages on, the report recommends greater powers and more funding for the WHO and the creation of a new global council to better coordinate the international response to future health emergencies. New Zealand's former Prime Minister Helen Clark is a co-chair of the report. Helen Clark, how much could have been done to make this pandemic less severe than it turned out to be?
Oh, an enormous amount. And what our panel found was that there were failures, gaps and delays in action all along the way, from the initial confirmation that this was a novel coronavirus in Wuhan. The public notices went out on that at the 31st of January. They didn't lock down the city till the 31st December. They didn't lock down the city till the 23rd of January. That's a big wait. The WHO didn't get enough information quickly enough. The genome sequence wasn't shared quickly enough. We can go on. So many delays. But we also look in our report at the month of February, when most countries took a wait-and-see approach rather than aggressively moving to either keep the disease out or contain the spread. And that proved to be very, very harmful as well.
In terms of China's early failure to close down Wuhan, was that deliberate concealment or did it just simply get ahead of them?
Well, it may have got ahead of them. We haven't really looked for motive on that, but people were travelling very widely for Lunar New Year, 3 weeks after Wuhan had issued its public health notice about this new virus. And that seems a very long time lag. The other thing we find formally is that the WHO is underpowered for the job expected of it. Of course, it's underfunded, but it's underpowered as well. It doesn't have powers or right of access to go and verify. It can't publish information it has about a country without the country's permission. It feels constrained in taking a precautionary approach, assuming the worst might happen and acting accordingly. It has to wait for an emergency committee to be convened and recommend that a public health emergency of global concern be declared. That too had a week's delay. Met on the 22nd of January, couldn't agree to issue the declaration. It only happened a week later. So in the 21st century, when a virus is on the next plane, these are all very, very deadly delays. But then so is the failure after that of countries to act quickly enough around the world.
Of the panel's recommendations, which would make the most difference to future preparedness?
Countries investing in it. I think preparedness has been the dog that didn't bark. We have escaped a global pandemic like this for over 100 years, since the flu pandemic of 1918. And I think people got complacent. They saw SARS, of course, which was a worry, but the worst didn't happen. We saw Ebola in West Africa and in Central Africa. The worst didn't happen for others. So we've got complacent. We've stopped investing. We didn't have the personal protective gear on hand. We didn't have all the things you need, the quarantine facilities, the testing and contact tracing systems. There's so many things we didn't have. We just weren't prepared. Hard to find many countries that were.
The pandemic is still ripping in a devastating fashion through the developing world. Is there anything that can be done right now from what's been learned to mitigate against that?
Yes, many things. When you have a raging pandemic, you have to stop mass gatherings where people come unmasked. This appears to have had a super spreader effect, for example, in India, as that last wave of the pandemic there took off. In Brazil, there's never been effective public health measures because the leader doesn't agree with them. We had the off and on approach in the US under the previous administration. There are proven methods that work. Now, of course, the vaccines have been an incredible breakthrough, but they're not equally distributed. And we face the prospect now of high-income countries like ours fully vaccinating everyone who'll be prepared to take a vaccine, but other countries waiting several years. That's not right. And we can't stop the pandemic until we stop it everywhere. It's not enough just to stop it in Australia and New Zealand. We have to stop it across sub-Saharan Africa. We have to stop it in South Asia. We have to stop it in Latin America as well.
Helen Clark, thank you for your work on this and thank you for joining us tonight.
Thanks, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.